Welcome, everyone. My name is Amanda McIntyre, and I am an assistant professor at Western University in the School of Nursing, and I am the chair-elect for the Nursing Research Interest Group. The virtual NRIG webinar series was initiated to share and promote nursing research and scholarship across the broad nursing community in Ontario. So our speakers usually present for 30 to 40 minutes, and this is followed by a time to take questions. Because we're using the webinar format, we ask that you stay muted until the end of the presentation, and then our speaker will take questions. We do encourage you to add questions or comments into the chat or the Q&A function so that our speaker can address them at the end. And please note that today's session will be recorded. So today's NRIG webinar speaker is Dr. Laurie Peachey, and she is an associate professor in the School of Nursing at Nipissing University. She's a Canadian certified simulation nurse educator and Canadian certified perinatal nurse. Her research interests are in maternal child nursing care and in simulation. And we're very happy that she's agreed to join us today with her presentation, Shaping Clinical Imagination and the Use of Maternal Child Simulation. So I'll hand it over, and Laurie, you can go ahead.
Thank you so much for the introduction. First, let me begin by thanking the Nursing Research Interest Group for the opportunity to speak about clinical imagination in simulation. And a special thank you also to Nipissing University student representative and advocate for the Nursing Research Interest Group, Kieran Blake, for also inviting me to present today. I will begin by sharing my screen and sharing my enthusiasm for simulation to become a place for the development and the fostering of clinical imagination. The goal of the presentation in this webinar today is first to outline the use of Van Manen's articulation of phenomenology, which is the methodology used in this study, and to describe the methods used in phenomenology of practice as a basis to delve into human experiences. So really the relational aspect of simulation through narrative reflections, and to also highlight that simulation is also a good topic for qualitative methodologies. And last but not least, to reflect on the opportunities for clinical imagination in simulation-based learning. Phenomenology always begins with situating yourself in the phenomenological study. And so using the phenomenology of practice, it's really important that I situate my role and my experiences in simulation-based learning with not only the participants, but in how I disseminate the findings. I am a maternal child nurse with perinatal specialized experiences in Northern Ontario in the context of mostly northern small rural hospitals. And I am also a nursing educator since 2004, and I have had the opportunity to really dive into simulation, maternal child simulation, as it was first beginning to be introduced in nursing curriculum. And I am also a researcher in my role in academia. The drawing on the right is something that through reflective practice I had produced, and I'm not an artist, but artistry was really important in this phenomenological study. And so you can see at the core of it, I drew the mother and child experience or maternal child experience with all of the components that are very important to me and have influenced my views on practice. For anyone wanting to access the publication from this study, it is in the Nurse Education Today journal, and it was published in 2021, I believe. The background for the study New graduate nurses first describe the transition from being a student to entering the role of practicing nurses as challenging. And that is and has become more prominent as we come out of the pandemic and we experience a fast-paced environment in the practice setting. To compound that problem, professional programs in Canadian universities are experiencing and continue to experience a shortage of practicum placements required for learners to gain that practical knowledge. It's a very competitive environment, often reserved for a more experienced learner to have the very focused and very necessary experiences. Therefore, programs in professional education share a common goal of providing students with learning opportunities that require them to apply their knowledge and assume greater professional responsibility. And that largely means that traditional placements continue to hold an importance in nursing and in nursing academia, but while on-campus simulation centers can offer practical learning strategies that can really focus on those moments where we can reflect, we can have dialogue, and we can build our imagination of what will happen, what is likely to happen in the clinical setting. The purpose of my study was to discover the new graduate nurses' perception, both in their practicum and in their simulation experiences, and how they may serve or may not serve to understand the sustainable 21st century practicum in professional education. The purpose of this study is to understand the ways that new graduate nurses perceive their transition into practice following their experiences in maternal-child simulation. There is an overarching research question in this study, and it is phenomenological in nature. It really looks at uncovering the essence of a lived experience. And the question is, what is the lived experience of new graduate nurses entering practice after a practicum with maternal-child simulation? The sub-questions really are meant to look at that clinical imagination, and so therefore are meant to look at in what ways does the lived experience in maternal-child simulation prepare for reflective practice, for the ethics of caring, and for clinical imagination. The theoretical framework borrow from Dewey's theory of experiential education, Bandura's social cognitive theory, Schoen's reflective practice theory, and Benner's stages of clinical competence. As I began the lit review, it was apparent that there are four major themes or major components that inform this study. The first is what occurs in practical education or practice education or practicum education in professional programs. Second is how we shape professional formation, how we build that professional identity. Third is that practice readiness. We're all in search of being practice ready and what that means for entry to practice into nursing. And last but not least, how those simulation-based experience can shape those three other components. And so for practice education in professional programs, I really looked at simulation practice education, looked at the INACSL standards, looked at what current definitions exist in simulation, and that simulation is more than the technology. It is an immersive experience. It is beyond the technology. It is the learning that occurs in those reflective moments. I also looked at the guidelines for practicum in simulation to really understand that it is a competitive environment to have students be in the clinical practicum setting, and that simulation has a role, but should not replace. It should enhance the practicum experience. And in saying that the selection of the practice experience should be very mindful, very careful, and very well and effectively delivered. For professional formation, how we shape that identity, I really looked at Kinzella's work, the Benner and Schoen's work in phronesis, the practical wisdom that occurs in nursing, and how we can build and shape those experiences for nursing students. And the main feature in this study is the term coined by Patricia Benner of that clinical imagination. So bringing the clinical practice setting, the simulation setting, and the theoretical aspects of nursing, both the science and the art, to flourish and create moments of clinical imagination. In terms of practice readiness, the frameworks for entry to practice, CNO's entry to practice competencies were key. The Canadian Patient Safety Institute's information, literature on fostering a culture of patient safety, how we can foster a positive transition into practice, and that relational practice can be focused on and built and shaped in simulation-based experiences. The last but not least of the lit review really looked at a lot of quantitative methodologies in simulation as being predominantly the area of research, but that there is a gap and there is a need for more qualitative studies to present the student perception of simulation and to look at using simulation for shaping clinical imagination and for role clarification. And in that, I opted to use Van Manen's articulation of phenomenology that really seeks practical insights, ethical sensitivities, reflexivity, and the meaning of being, the meaning of becoming a nurse. Phenomenology of practice provides the basis for methods used to delve into that human experience of being in the clinical setting, of being in simulation, and using narrative reflections to understand the student and the learner perception of being in those moments. Hermeneutic phenomenology fosters writing in-depth and rich descriptions, thick descriptions, consistent with an epistemology of practice. The study involved phenomenological interviews, a two-step interview approach captured to capture experiential descriptions in a semi-structured hermeneutical approach. The first interview served to contextualize the lived experience and to initiate experiential conversation. So the first interview was really to set the stage as to what was really going on in the participants' current practice. And the second interview allowed for the reconstruction of the detailed experiential accounts of the participants to verify and elaborate their descriptions and to really look at, is what is happening in their first year of practice really what they had imagined would happen when in simulation as students. And so a journal was used to reflect on the ways to best capture their stories and to prepare vignettes as new nurses. And the vignettes is really what I'm going to present in the next few slides. The third interview served as member checking. A member checking contact provided authentication of information, and it consisted of a review of the transcripts and how I had written each vignette of each participant's story of how their first year of practice had in fact unfolded, and if they felt that it had if a simulation in their student experience in their final preceptorship had shaped a lot of that clinical imagination. The recruitment of participation involved looking for new graduate nurses in the first 2 years of practice. And so 10 participants were in the study, and 1 participants with less than 6 months of practice experience, 5 participants with 6 to 12 months, and 4 participants with more than 12 months. 5 of those participants came from our or a direct entry BSCN program from a high school. 2 came from an undergraduate degree prior to having a BSCN. 1 came from an undergraduate degree RPN diploma bridging into BSCN, and 2 from RPN bridging without a diploma or without a degree, rather, into the bridging program. Participant vignettes are presented here. David's entry into emergency nursing, Megan's search for neonatal certification, Lily's lifelong learning plan, Meredith's move into neonatal nursing, Hazel's adventurous beginnings, Lexi's passion for the perinatal unit, Lisa's insight on dual registration, Derek's unexpected transition, Liz's longing for more learning, Jenny's experience in pediatric nursing. And so it is difficult to capture the richness and the vignettes in a short webinar presentation, but the essence of the lived experience is really capturing the participant stories in vignettes. And 10 vignettes is a lot for a phenomenology of practice. And I'll get to the limitations, but it was a lot of information to synthesize and a lot of transcripts to thematically analyze. So I therefore use the phenomenological methods of capturing thematic analysis through significant statements and phrases. So going through the vignettes, rereading and recapturing their stories to look for significant statements that flowed through consistently throughout the vignettes. And so I have in table 3.4 groupings of significant statements that would reappear in the vignettes, and allowing the emergence of themes, and which would result in an in-depth description of the phenomenon. And I did not use a software program. It was important in the experience of phenomenology of practice to situate my own practice and my own reflexivity, to allow the emergence of themes to present themselves and for things to show themselves naturally and organically. The themes that emerge through reducing the statements are these following 4 themes. Students, new graduate nurses rather, in the vignettes spoke about wanting desire to perform like a nurse, and that really spoke to the imposter syndrome of I want to think like a nurse, I also want to look like a nurse, but most importantly I want to perform in the skills, in the critical thinking, and in the practice of a nurse. The second theme was shaping and forming a clinical imagination. So looking for those simulation, which they largely talked about mock codes and codes in situ simulation experiences in their workplace, to continue to shape and to form what could happen in their practice, and how that simulation experience could form a clinical view or an imagination of what could take place. So really looking at shaping their practice with the most common, which is likely to happen in their practice, but also the most dangerous and the most life-threatening. So shaping a good clinical imagination of those 2 things that can happen in the first 2 years of practice. Third was embodying the role of the novice nurse, celebrating, embracing, and really accepting the novice nursing role, and to find those mentors, to find those moments of highs and lows in practice, and looking for a mentor and those learning opportunities in the clinical setting as they settle into their first 2 years of practice. And that sort of lends itself well to embracing lifelong learning in simulation, and that realizing it, acknowledging that simulation would become a way or a modality to embrace lifelong learning in their clinical setting. In performing like a nurse, the participants really looked at nurturing the nurse's intuition, forming a clinical imagination through the use of realism, through the use of simulated patients, through embodying a greater depth in debriefing, looking for abandoning the blame culture and embracing the patient safety culture and interprofessional care, and also to look at lifelong learning and simulation being part of a lifelong learning as being embracing anxiety or the anxiety provoking emotions that come in with simulation as the new normal. In the first theme, the vignette or the vignettes really looked at exposing the need or the desire to perform the role of the nurse, to admit feeling like an imposter, and to nurture the nurse's intuition. And in David's vignette, David shared that being exposed to a simulated environment and taking a serious approach to preparation helped manage a simulation at the hospital. Taking a step further, the simulated experience helped to give better care when those situations arise. For Lily, being observed in simulation provoked feelings of pretending to be in a role rather than embodying the role. And Lily described entering a simulation scene was shocking, that being part of a Code Pink was terrifying, and that everybody was there, but that it does nurture the nurse's intuition, and that it could really happen during the course of a shift, as Megan pointed out in the third vignette, that she was able to identify some of her learning needs and to address them with the clinical educator later in the week. The second emerging theme really highlighted the shaping of clinical imagination. As Lexi pointed out in the vignette, because of simulation, I am now imagining the possibility before they happen or before they have a chance to happen. And Meredith explained that simulation or working with the simulated patient gives my brain another place to go to when I'm having a conversation with someone playing a role rather than talking to a mannequin. And so in this theme, many of the vignettes highlighted that high fidelity simulation is great, but the use of actors and the simulated patient really does shape and form clinical imagination more effectively than the use of high fidelity mannequins. When it came to the third theme of embodying the role of the nurse and integrating theory with practice, having repetition, having a greater depth in debriefing or wanting a greater depth in the debriefing experience, and abandoning the culture of blame and embracing the patient safety culture, and also looking for IPC and IPE moments in their practice. The vignettes, I've taken 3 extracts from the vignettes, and Lexi says simulation helps because you repeat things, you prepare yourself for what to expect. Then in preceptorship, you get actually to see it in the safety and guidance of a nurse preceptor, and that she had had the opportunity to approach situations that had only been simulated before, and those experiences had prepared for being on her own. It's hard to imagine not having that preparation, not going in or going in. Jenny really highlighted that simulation is where she really learned, that it allowed for mistakes, it allowed to go through everything and to determine a vocabulary that pediatric patients and their family were going to understand. So having that imagination of the dialogue and the terminology that is more appropriate for the maternal child and the perinatal and the pediatric experience. Derek also looked at the opportunities to work within a team and to look for others or other people's cues in simulation to really help to reduce that anxiety, and that if he didn't know something, that was fine, that there is a chance that someone else will know, and that if we all succeed together as a team, that we can achieve personal success. Embracing lifelong learning in simulation is also quite important to the participants in these vignettes. Anxiety felt like a new normal. It felt, though, that there were strategies to help with anxieties, with those anxiety, moments of anxiety. It also looked for some days were just harder than others, and that there is great admiration for those expert nurses that they came across in preceptorship and also in the first 2 years of practice. Liz said that there's a lot to learn, that she discovered in preceptorship that there's a lot to know, there's a lot of protocols, there's a lot of clinical guidelines. It's just overwhelming, it's just so much, and that she felt that she only touched the surface while in preceptorship, and that the imagination can continue if simulation continues in the workplace, if that the workplace can embed in situ simulation opportunities and experiences, that clinical imagination can continue to be shaped and fostered. Hazel looked for engaging in simulation as learning experience, and sometimes she would participate in the care of and other times she would observe, and she would step back and watch and learn. It depended on the situation, but she definitely took advantage of everything she could in those first 2 years of experience to embrace lifelong learning in simulation and to take advantage of being around those expert nurses. And so the vignettes really were meant to produce the essence of becoming a new nurse and being in simulation. There are two really components of the essence of becoming a new nurse and the essence of being a new nurse in simulation. One is to have the opportunity to shape clinical imagination, and the second is to have ongoing exposure to simulation and the shaping of professional identity. Nurses must imagine the multiple clinical scenarios that present themselves in practice, but also participants described those simulation experiences and those mock codes in the clinical site as ways to facilitate socialization in the workplace and as a means to ease the anxiety during the transition to practice. There are limitations in this study. The first is the temporal aspect of being in maternal child simulation. The interviews provided rich data beyond the experience of being in maternal child simulation and into the depth of becoming a nurse. And so what that means is the study was really meant to look at maternal child simulation, but when we really developed the vignettes, the participants shared non-maternal child simulation experiences. And so it became really difficult to section and segment those out. And so being in maternal child simulation was captured, but the data was so extensive that there were experiences that went beyond being in a maternal child simulation and more into the depth of becoming a nurse in the first 2 years of practice. The second is that the participants indicated ongoing exposure to maternal child simulation and that they had simulation in general in their clinical practice. Their stories drew various simulation experiences beyond pre-licensure, so beyond the preceptorship aspect and beyond the learner role and into the first 2 years of experience. So there were much more simulation experiences in the first 2 years of practice than anticipated initially. Not really sure that qualitative studies can make recommendations, but looking at the vignettes, so the stories inform the need to really look at design of simulation-based experiences need to be immersive. So in the vignettes, the participants really indicated that if they were going to be removed from practice in their workplace and or removed from the clinical setting as learners, in their degree, that it needed to be immersive, it needed to be realistic, and it needed to accord careful attention to detail of the clinical environment being simulated in order to effectively shape their clinical imagination of what can occur in the workplace and in the clinical practice setting. The second recommendations based on the vignettes or on the lived experience is to combine the unique needs of nursing students approaching graduation with the simulation-based experiences that integrate interactive strategies relating to the transition into practice, to really look for those moments to ease and to welcome that transition into practice. And so moving away from necessarily the skills aspect of what simulation, low fidelity, high fidelity simulation can offer, and maybe shifting that into moments of dialogue as to how you will be made to feel in the transition into practice, in the transition into becoming a registered nurse. And last but not least is to incorporate more SIM IPE into health education curriculum to assist new graduates with practice readiness. And so the participants indicated that their IPE experiences were limited as students, and they began to be increased in the workplace in situ simulation experiences, where on the unit they are pulled from their workday as new graduate nurses, and the simulation is very much a SIM IPE experience. And so embed more of those experiences in health education curriculum to assist new graduate nurses with the realistic aspect of practice readiness and the practice setting. Final reflections from the study is that there is a messy and uncertain journey towards the understanding of the meaning of becoming and being a nurse. And the vignettes offered beautiful moments of entering practice, both in simulation and outside of simulation. The stories inform the reader about what it is like to be a nurse in the integrated, innovative maternal child simulation experience. And as the participants described the ways of bringing theory and practice closer together, they shared a desire to develop clinical imagination and to be immersed in simulation in practice. And that the lived experience raises more questions on the connection between nursing education, simulation-based experiences, and the need for practice readiness. And I want to acknowledge the contributions of the participants in this study. They are new graduates willing to share their experiences of their transition into nursing. And I have attached a few references from the study. Thank you, and I am happy to take questions.
Thank you very much, Laurie. That was fantastic. I'm going to go ahead and stop the recording.